Everything depends on how we perceive, how we understand. When you have, a rash on your skin, okay, the doctors, they can go and observe what is happening. So you come up with a treatment. But with the brain, there's nothing that you can directly observe. So we are using different modalities like MRI and maybe EEG, MEG, in order to understand and explore the brain. Maybe the more we will observe, the better we will understand.
Our ultimate goal is to find out the neurophysiology, neuropathophysiology of the disease. I mean, what is the problem in this disease? How can we distinguish healthy people from Parkinson's disease patients?
So in this project, we collaborated with neurosurgeons and established new interfaces and signal processing tools to optimize the deep brain surgery.
Dr. Ince brings a very unique expertise in studying the electrical activity of the brain to improve the therapy of deep brain stimulation for patients with Parkinson's disease and other movement disorders.
Parkinson's disease is a movement disorder. In general, the patients are receiving a certain medication, so their symptoms can be controlled. But in some patients, the symptoms cannot be controlled. So DBS becomes a solution in those cases.
Deep brain stimulation involves placing 1 or 2 very fine probes into the brain to electrically stimulate the brain, and it helps to normalize the activity, which is not correct in patients that have movement disorders.
The surgery starts in the early morning with an imaging step for surgical planning. Once the planning is done, 3 microelectrodes, 3 probes are inserted into the brain in order to explore this pathological synchrony in the brain.
It's a very small electrical probe, so smaller than the pencil lead of a number 2 pencil, and it's placed into the precise targets into the brain which are not behaving properly in Parkinson's disease, tremor, obsessive compulsive disorder, and other disorders.
And the neural activity is measured step by step from different depths until the microelectrodes hit the pathological target in the deep brain. And then we are using the oscillations of the brain and simply making the computers to interpret these signals and give a feedback to the neurosurgeon such that they can say, yes, I'm at the right target, I'm at a good location, and I can implant the chronic electrode at this particular position.
So there are a few benefits that we look to see. One is choosing the proper target for a given patient and stimulating only the particular part of the brain that's not functioning properly. The second thing that we're hoping to see is an improvement in how long the batteries last by able to stimulate at lower levels, treating precisely the correct area of the brain that's having problems.
So we simply tested the feasibility of using brain activity to select optimal contacts.
So now, with support of our industry partners with Medtronic, we're looking to take this to the next stage where we understand where the electrical activity is incorrect, stimulate in response to that, and move towards a closed-loop stimulation model where we're only stimulating as needed and when necessary.
So we are going to actually transfer this knowledge now to the industry, and hopefully this will lead to the establishment of novel technologies for the treatment of PD.
Really, tremendous progress has been made in the last 5 years, largely in part to the work of Dr. Ince. He has been supported by the National Science Foundation for studying deep brain stimulation for movement disorders.
This is an interdisciplinary study, so neurologist, neurosurgeon, and biomedical engineer, they are all coming together to explore this problem. But what we are also learning is that after observing all these cases, there's a great need for novel technologies in the surgical field. My hope is in the next few years, we will train engineers who will participate in surgeries, who will work close with neurosurgeons to help electrode placement, interpretation of the signal.
So I think it's one of the few specialties in medicine where we're really able to impact quality of life in the longer term. And if you look at deep brain stimulation in particular, it's one type of surgery that we have very, very high quality evidence to say that it benefits the right patients.
Imagine there are so many neurons, we are just capturing just a few of them with these machines. Like if we can record a few hundred neurons, that will be amazing. If we can record from thousands of neurons, that will be tremendous. I mean, that will be a miracle for me.
Most amazing thing is, while I was working in biology labs, you're doing research. I mean, you're doing experiments in the wet lab, and it takes long time to see the outcomes of these experiments. But in surgery, you do something and you can immediately see the result of this action. You develop something and you apply this in the OR and you see the results immediately. You see the benefit of the patient, benefits in the patient, or it's very quick, and you feel like, okay, you're contributing to science, to clinic, you're helping a patient, and you can see it in the OR. It's amazing.